Hello, welcome. Phil from Citizens for Health Awareness here, providing an update on the public meeting that was held Tuesday night, 12th of March 2019, providing the public with an update on where things were at with the government's introduction and proposed introduction of No Jab, No Play. So, as an overview, No Jab, No Play, the primary intention is to increase vaccination rates amongst the youngest of our population. The way the government intends on doing this, first of all, through regulatory changes, which began being implemented January 1st this year. It's essentially increased reporting, or mandatory reporting if you like, of children attending kindergarten and daycare. They have to provide their immunisation status, which is documented on the Australian Immunisation Register. This does not necessarily mean that the children need to be fully up to date with the vaccination schedule at this point. They just need to provide details of what vaccinations the children have had. And there's subsequent requirements for the daycare and kindergartens and so on as a result of that. So these are regulatory changes that the state government has implemented. They are also proposing legislative changes, i.e. changes to the law. There has been a proposed bill released last week. Now, the proposed bill has... We're in a consultation period, essentially a 3-week consultation period, and we from Citizens for Health Awareness would encourage everyone who's concerned about this policy and its impingement on our freedom to choose what medical interventions we adopt on our own persons and our children. To make a submission by the 26th of March. So that really is the key point about what we'd like to get across at this point in time. There's other subsequent steps, but really getting everyone to respond to the proposal during this public consultation period by the 26th of March is the key here for the short period, at least anyway. So the proposal that the government has outlined does offer a number of different options. Essentially, it's divided into option A and option B. Option A is to progress as things currently are with implementation of the regulatory changes and see how that goes. We would expect that with this increased reporting and requirement to report and so on, that the state government would find that the vaccination rate amongst the population of children that they're looking at is up around that 95% mark, and therefore there's no need really to introduce their more draconian measures of preventing our youngest children from attending daycare and kindergarten if they're not fully up to date with the schedule. So this is option B, which is divided into a number of different proposed ways of going about it, 7 or 8 from memory. And like I say, the option B in a nutshell is preventing children who are not fully up to date with the Australian vaccination schedule from attending kindy and daycare. So it's obviously a concern. There's very limited, mosquito buzzing around. There's very limited exemptions available for anyone who's ever looked into medical exemptions in Australia nowadays for vaccines. There's not a lot to go with. Essentially, you have to have an anaphylactic response to each and every vaccine on the schedule before you can be exempt from having any of those vaccines further. On very rare occasions, and I mean very rare occasions, medical doctors may provide medical exemptions due to people having cancer and other immune deficiencies and so on. But the number of these, if you look at how many have actually been passed in recent years, is absolutely minimal. Often hearing stories about people not wanting to get their kids vaccinated because they've reacted before, and they're told, "Oh, that's all right, just come into this ward at this hospital, and we'll have the crash cart ready to go in case they die, essentially. So, and we'll revive them," which is obviously a concern for a lot of parents if that's their options. So, getting back on track, no jab, no play. We're in public consultation period for 3 weeks. We have just over a week and a half sort of thing before the 26th of March, when that consultation period will be over. So obviously we're looking at promoting option A, which is retain the status quo as it is at the moment, and no way do those of us concerned about the impingement on our freedom to choose medical interventions and so on, do we want option B, which is, as I said, a more mandatory and draconian approach to increasing vaccination rates. So the AVN has produced, Australian Vaccinations Risks Network has produced a lot of good information on their website. We had we put together a bunch of different documents for the meeting on Tuesday night, which cover a lot of this information that I'm talking about. This information will be made available on Citizens for Health Awareness Facebook page, and also, as I was just about to move to, the AVN has some very good information on their website as to how these policies can be contested, different pertinent issues relating to the policies and so on. And the AVN is also producing, should be available either today or tomorrow, being Thursday or Friday, a guide as to how the public proposal response can be filled out, just to help those who aren't sure how to go about it. So keep an eye on the Australian Vaccination Risk Network website and or Citizens for Health Awareness. So just moving along, back to the meeting. We were fortunate to have Dr. Judy Wileman present her a speech, if you like, a talk on choice in vaccination and our right to bodily integrity. She talked about the underpinning science and her research that she compiled in her PhD thesis on this topic, and where some of the shortfalls in science are at this point in time, and has developed 5 essential questions which our state government really needs to answer in order for us to be confident that they've looked at all the ins and outs of the underlying factors associated with this policy. So what is the science behind their policy? How well does the government's science support this policy? So that information, those 5 questions, are worth having a look at. Anyone who was at the meeting will be emailed this information. Otherwise, like I say, you can find it on Citizens for Health Awareness webpage shortly, and or Judy Wileman's website, which is vaccinationsdecisions.net. So that was an interesting talk. I could see that a lot of the public got a lot of useful information out of that. And then I presented further information on how we can address these policies. And again, the priority here is responding to the government draft proposal during this submission period, and again, 26th of March is the cut-off date on that. Really emphasising this, of course, because time is near to get those in if you haven't already got them in, and this is really important. Following on from that, I would encourage everyone to be communicating with their politicians. Again, we had some information prepared which covers who we should be looking at communicating with so far as politicians go, who holds sway, who's worth talking to and so on, contact details for them, some good information there on how to present yourself to the politicians. We want to be taken seriously. This is a serious matter. It's of huge concern to a lot of people, and it should be of huge concern to the politicians. So we want to make sure that we communicate these concerns clearly and succinctly, so the politicians can understand where we're coming from. Many of us are often referred to as anti-vaxxers. However, most of the people that I know working on this issue are either ex-vaxxers or pro-choice, or just looking for a greater degree of rationality, questioning vaccines, vaccine hesitant, whatever you like to call. But there's not so many people that I know that are actually anti-vax working on this. So let me just see what else I need to cover. Okay, so also, as well as communicating with politicians, we obviously need to communicate with our friends and family in order to get them to take action as well. We need to consider signing up to Parents Coalition, which we'll have more information on shortly. Parents Coalition will be representing parents around WA in communications with the government, and we need people to support the AVN, Citizens for Health and Awareness. Essentially, we need people to take action, and take action now, and take strong action, be brave, stand up, and do what's important to you, your family, your community, your health. And I know the government and the media are always talking about, well, we need to do this because there's some members in the population that can't be vaccinated and it's just selfish behaviour and so on and so forth. But really, it comes back to the fact that those of us in this community looking around and seeing what's going on is seeing a lot of vaccine injury, and we have concerns about it. And those like myself aren't saying all vaccines are bad and no one should be vaccinated, but we should have choice in vaccination, because where there's medical procedures, there's risk. And there's certainly risk in this situation. And from what we're seeing, and even from the government statistics, you can see quite clearly that the chances of having significant injury are much higher than 1 in a million. And simply, these risks, these issues are not being recognised by the government, by the health department generally, and certainly not by mainstream media. So there are concerns. We would like to be heard. We live in a democracy, so therefore we believe we should be heard on this issue. There's a lot of good science to support what we're saying. I draw attention to the Royal Australasian College of Physicians announcement in recent times. I'm just going to read from this, which is a document on the Australian Vaccination Risk Network website. The Royal Australasian College of Physicians is a professional medical college of over 17,000 physicians and 8,000 trainee physicians, which includes specialist paediatricians from Australia and New Zealand. In their submission to the 2016 statutory review of the New South Wales Public Health Act 2010, they opposed abolishing conscientious objection. And then in a letter to the South Australian Communicable Disease Control Branch of the Department of Health, the RACP 2017 expressed concern about children being denied the benefits of early childhood education, and that the risks posed by incompletely vaccinated children are often exaggerated. And in italics, I believe this is a quote, therefore, as paediatricians who advocate for the welfare of children, we are bound to draw attention to the enormous body of research demonstrating the benefits of childhood education before school commencement, especially in disadvantaged households. Denial of this access is a serious matter with likely long-term adverse consequences for the healthy development of the children involved. In this context, the risk of vaccine-preventable diseases to fully vaccinated children from children who are under-vaccinated is often exaggerated. And then down a little further, the RACP believes compulsory documentation of immunisation status and allowing prompt exclusion of under-immunised children should a case or outbreak of vaccine-preventable disease occur provides sufficient protection to all children attending an early childcare or early childhood education service. As explained above, universal exclusion of under-vaccinated children adds little or no further protection. So this is from our most reputable source. They do not back no jab, no play exclusion approaches to kindergarten and early daycare, and we're often told, get your advice from the doctors. Well, here's some doctors, and they don't see that it's a reasonable approach. So there's lots to consider, there's lots to be looked at. Please keep updated, sign up for emails via either Judy Wileman's website, vaccinationsdecisions.net, and or the Facebook page, Citizens for Health Awareness. Sign up for emails. Huge amount that can be done. We just need everybody and anybody who's concerned by this to stand up and take action. So I'm going to leave it there. Keep it as brief as possible. I've actually gone over time for what I intended to do. So thank you all very much for taking note of this, and have fun writing those submissions and contacting your politicians. Hopefully we get a positive result that is beneficial for all Australians. Thank you very much. Signing out, Phil from Citizens for Health Awareness. Thank you.